Hello, this is Dr. Anjali, consultant physiotherapist, and I deal with a lot of hypermobile EDS syndromes, helping people with pain, fatigue, management of loose joint, dislocated joints, managing their menstrual cycles, prolapse issues because of it, TMJ, POTS, anxiousness, everything which is related to hypermobility with respects to pain and the bodily issues with respects to mast cell activation. We all see this. In this photo, you see that this lady is doing various kind of movement. These are called as the Python scoring. If you are hypermobile, the range of the angle which you have will be scored on a Python scale, and in a scale of 8 to 9, if you are able to do all the movements in each part of the body, each side of the body, you get a level of 8 or 9. This lady had his mother who died of connective tissue disorder. Her mother remained undiagnosed for many years and was referred to a psychiatrist for treatment because nobody was able to get to the root cause of her problem. She was considered to have a psychological disorder and was also considered to have schizophrenia and bipolar disorder. It's really sad. And I met this mother when she was about to deliver with a lot of back pain, and that's when I saw her as at Apollo, and she gave birth normally. Most of the hypermobile people will be very easy on birth to give normally, but many of times this hypermobility is the biggest cause of people not able to get sleep because of adrenaline in the night. Then they have something called as gastric acid reflux. They're not able to empty their bowels and bladder in time. A connective tissue order where your skin is so stretchy in nature, your ligaments are so stretchy in nature that they kind of slip out of their joints very easily. There's stretch mark, there's scar tissue, and there's very slow healing in case of surgeries. People of their EDS and hypermobile have sleep disorders. They have postural malpositioning of the joints. They walk in a peculiar manner, waddling gait or a duck gait. They have very fragile tissue because of which many of times they end up walking with a walking stick and a wheelchair. They are very prone to dislocations, unstable joint. They have scoliosis and kyphosis, and mainly termed as kyphoscoliosis. They are resistant to anesthetics. So most of the dental surgeons should be aware of this kind of body type. They also suffer from allergic reactions and immune reaction called mast cell activation. Their dental palate or the palate is like a parrot, is the crow palate, and they always have POTS, which is lightheadedness on standing up, syncope, and they're very resistant to a lot of medication in the form of pain medication, allergic to various drugs on the counter. They are full of hormone called relaxin. So most of the women who have hypermobility will end up with dislocating their hip joint during the period's time. They will dislocate their temporomandibular joint. They can dislocate their rib cage just on a laugh, just on a sneeze. They are very atypical stretch marks, and they are constantly looked out for bruises, and their skin and their arteries will be very fragile. And the blood vessels and organs are also very prone for rupturing. Many of the women end up with uterine prolapse, many of them end up with hernia, and all of them would have a very poor prognosis when they go for surgery because the repair of their bodies are very difficult post the surgical intervention. This is Dr. Anjali.